today's session is the 5th. If we just put the next slide up, Sue, please. It's the 5th one of 5. So we've already learnt about why physical health of people with SMI is our problem and not somebody else's. We've looked at how somebody can keep healthy. We've looked at how we might support somebody with a severe mental illness to be healthy. Last week we looked at actually carrying out a health check and what that might include and how we might go about it, and do we have to do it. And so today's session, we're going to look at how we can make the physical health of a person with SMI part of our everyday care. So looking at what do we need to change, what do we think should be changed, and who do we need to help us. Okay, so the next slide. So these are the actual objectives that I hope we'll fulfill. So I want all of you here to feel motivated to do these things. You might not be able to physically do them, but if you feel that you've got the drive to do it, that's always a brilliant start. So for you to feel motivated to assist your organisation to fulfil its responsibilities regarding physical health monitoring, for you to feel motivated to ensure that people with SMI who have acute mental health issues, that they're dealt with appropriately and actually, quickly, that you want to assess the support available in your organisation to patients with severe mental illness to manage their long-term physical conditions. That's something that's often neglected. People with a severe mental illness often have a number of other illnesses as well, and vice versa actually, and that you'll want to find ways to provide the support required by patients with SMI to adopt a healthy lifestyle. So we're going to go through all that in this session. So thank you. Next slide. Of these conditions as well. So it's about the person will have had some, hopefully, probably not very much, but some kind of education in how to care for that condition themselves. And as a nurse or support worker or whatever, part of our role is to help them manage their life, and part of our role would be to help them manage that condition. So we'll just go on to the next slide. So here I've put what we need to know and what we need to be able to do when we're looking after our patients. So do we know where to get the help patients need, and can we access it easily? Do we know where to go if we need some help with that? How do we access that? Are we aware of what's happening within our organisation? Because you aren't an expert, but you are there to kind of help the patient. Do we have access to information, advice, support leaflets, care plans and instructions, education? Can we answer questions? Are we aware of these specialist doctors and nurses? So if somebody's got rheumatoid arthritis, somebody's got Parkinson's, somebody's got any of these illnesses, and there's an issue with that illness, do we know what to do and where to go? And also, we need support to help patients understand their medication for physical conditions. And are we aware of the local support available to carers in their role and know how they can find out any information that might be helpful as a group? So we've got George, he's 28, he's been coming to your service for the last 6 months. He's got some psychosis, he has just had a 2-month stay as an inpatient, he's got type 2 diabetes, a blood test reveals his HbA1c, which is his glucose, has increased since his stay. Shocking. So that could be, for a number of reasons, it could be because he's started a new antipsychotic. It could be the lovely hospital food that he's been given and all the takeaways his family have been bringing in because the hospital food isn't so lovely. So it could be because he's just eating more because the antipsychotics made him very hungry. Okay, so what support would he get for his diabetes in your organisation? So what's the protocol and procedure within your own areas? Because every area is different. You know, in some areas there's there might be an intermediate diabetes nurse service. In my area there is. You can do that. In some areas they've got specialist diabetes nurses within the practice. You might be able to go straight to them. So if as an inpatient, it would have to be a secondary care diabetes nurse. You know, how do you contact them? So it's about knowing, you know, from your organisation, who it is that you would. And this again is to think about how do you support your patients to be physically well in your everyday practice. So forgetting the health check now, and to think about some of the things we learned in the first few sessions about how we might be promoting, you know, healthy behaviour at every kind of contact, really. You know, when we observe things that are unhealthy, you know, having challenging patients, having gentle conversations and encouragement.